Hello, everyone. I'm Richard Conway reporting for Room Now from ACR 2025 in Chicago. I want to talk to you today about a poster that was presented at Sunday's poster session. This was poster 568 by Damon et al. And this is an interesting poster to choose because it's about drug withdrawal when people are in remission, which is a pet hate of mine. We work so hard to get these difficult to treat diseases under control. And then once we achieve that, maybe spending a year or more doing it, we decide, oh, let's change things again. Let's try and take away the treatments that are working and see what happens. And we've had lots of studies like that in our diseases, and most of the time it just doesn't work. Things like rheumatoid arthritis, axial spondyloarthritis. Best case that we've seen, you get to about a year, you might have 50% of people still okay off the drug, but as time goes on, pretty much all of those people fall off the wagon, and everyone seems to end up needing to go back on their treatments. And yes, most of them do fine, 90% recapture when they restart the treatment, but that means 10% don't. And then what happens to those people? And maybe they need to cycle through multiple other agents to regain disease control. So I've never been a fan of it. However, this study suggested that maybe that taking the drugs away is always not the wrong thing to do. So this was a 10-year follow-up of a study called CRESPA. And CRESPA was a study in peripheral spondyloarthritis. So early peripheral spondyloarthritis. And what they did in that study was they treated people with golimumab, essentially. They had 60 people in the original study, and after a year, they stopped the treatment. 49 of the original 60 people were in remission at 1 year. So they then followed these 49 patients up for the next 10 years. And at the 10-year time point, 82% of the patients were in remission. And most impressively, 38% were in drug-free remission. So that says that maybe a reasonable percentage of these people can get away with taking treatment away. I think that maybe applies to these kind of slightly less common diseases we see, for want of a better word. So early peripheral spondyloarthritis is a slightly less common condition, and it seems to be that many of these people may achieve drug-free remission for a sustained period. So I'm Richard Conway. Follow me on Twitter at Richard PA Conway, and tune into Room Now for all the updates from Chicago.